Okay, we're gonna let people in. Everybody set?
Mm-hmm.
Okay, great.
Hi, everyone, and welcome to UC San Diego's Alumni's Triton Leaders Conference. We're so excited to have you join us for Advancing Equity, UC San Diego's Student-Run Free Clinic. This session will be recorded and will be available on demand via the Triton Leaders Conference Hub. Check back later for access. Before we hear from our speakers, there are a few housekeeping items that we'd like to address. You have entered this event on mute. If you are not speaking, we ask that you keep yourself on mute to help us hear our speakers. If you have questions or comments, please feel free to use the Q&A feature on the right side, my apologies, please use the chat feature and the raise your hand feature to be called on during Q&A. And lastly, a quick reminder about our UC San Diego Principles of Community. The goals of the principles include providing a fair treatment for faculty, staff, and students, encouraging a climate of fairness, cooperation, and professionalism, fostering inclusiveness, respect, and a welcoming environment, and promoting collaborative attitudes and actions. So with that, let's get started with our program.
Wonderful, thank you. I wanted to welcome you to our session. Today, we're going to be talking about the efforts of the UCSD Student-Run Free Clinic project in addressing health equity. And I wanted to, next slide, please. Wanted to just start with having you see some of the human beings and faces behind our clinic over the years and just set the stage that we're really all about our patients and our community. Next slide, please. For the outline of our talk, myself and Dr. Rodriguez, we're going to start by introducing ourselves, and then we're going to provide for you an overview of what we do at the Free Clinic, including touching on our history, our philosophy, our mission, where we operate, and what we do. And then we'll conclude with a discussion about the ways we believe that we're addressing health equity here in San Diego. And then we'd love to end with a question and answer session and engaging you in learning more about what we do and answering your questions. So let me start by introducing myself and then turning it over to Dr. Rodriguez. So my name is Michelle Johnson, and I am a family physician. And I went to UCSD for medical school, graduated in 2003. And for me, Free Clinic was a huge part of my journey in medicine. When I came to UCSD Medical School in 1999, I didn't have a very clear vision of how I wanted to practice medicine. But through my involvement early on in the Free Clinic as a first-year medical student, it became immediately clear to me that I wanted to dedicate my path, my career in medicine, to serving the underserved. And so it's been a very huge part of aligning me with my mission. I went to residency in Northern California in family medicine, and then came back to San Diego in 2006 and participated in a fellowship in underserved medicine. And I was meant to take that fellowship for 1 or 2 years, and I've never left. That was in 2006. So I've been with the clinic a long time, and it is absolutely a passion for me and where I feel most like myself. So I'd like to let Dr. Rodriguez please introduce herself as well.
Hi, everyone. It's so good to be here with all of you today. My name is Natalie Rodriguez, and I am also a family physician. I am what many people call a lifer at UCSD. I came to UC San Diego in 1995 as an undergraduate in Warren College and graduated in 1999. I took 2 years off and did research at the medical school, and then was fortunate enough to also attend medical school. And I was a student in the medical school from 2001 to 2005. Free Clinic was an absolutely instrumental part of my med school journey as well. Dr. Johnson and I have very similar stories in that way. For me, it was the community that I found at the Free Clinic that was just really life-changing for me. I had an idea of the kind of doctor that I wanted to be and the patients that I wanted to take care of, but I'd never actually seen it in action until I got to the free clinic, where I met amazing mentors who were taking care of underserved communities. And I found my people, so to speak, and was so fortunate to get to go to Scripps in Chula Vista to do my residency program. And then I also came back and did the Underserved Medicine Fellowship and have been back at UCSD as an attending and as a faculty member since 2008. And Free Clinic continues to be just a place where I go to be renewed and inspired by our students and our patients. So it is a true honor to get to do this for a living. To get us going today, we really love to start by sharing the mission of the Student-Run Free Clinic project. And really, truly, it cannot be said better than this. So I'm just going to read the slide, and that is, in partnership with the community, our mission is to provide respectful, empowering, high-quality healthcare for the underserved while inspiring the next generation of health professionals. And we talk a lot about the patient being at the center of everything that we do. And that is certainly true of our mission as well. Next slide, please. So just to go a little bit deeper into our mission, we have 4 core tenets of what we call our philosophy of care. And I'll just highlight a little bit about each one. One is empowerment, which is we believe in really empowering our patients, giving them what they need to take control of their health and their lives. And we work closely with our students to teach them that model of care. We believe in a humanistic approach to medicine that's really founded out of mutual respect. And we really view our patients as people and not as health concerns or medical issues, and encourage our students to really sit down and listen to a patient's story and meet them where they're at. Again, tying back into that empowerment model. Our care is transdisciplinary, which means we partner with so many other disciplines to give our patients what they need, not just medical care or health care, but addressing their other needs and social determinants of health. And we'll talk a little bit more about that later. And then lastly, and if I had a favorite, I would say this is it, and that is seeing the community as our teacher. Our community and our patients teach us so much. Obviously, they teach us about medicine and healthcare, but they also teach us about life and resiliency and are beautiful teachers to ourselves every day and to our students. Next slide, please.
Wonderful. So we've been talking about our patients. Who are our patients? I'd love to tell you about them now. Over time, actually from the beginning, our mission has always been to take care of people who have no other place to go, to take care of people who don't have any other access to care. And as you know, as health policies have evolved and changed, including the implementation of the Affordable Care Act, the demographics of who's been uninsured has really changed over the 20 plus years that we've been operating our clinic. So initially we had a pretty high percentage of homeless individuals as our patients, but currently our demographics have shifted, and the majority of the patients that we take care of are Latinx adults. All of our patients are uninsured, so they have no other access to care, and we provide a safety net for them. All our patients are low income and face many, many barriers to wellness and to healthcare, including language barriers, cultural barriers, sometimes immigration barriers, food insecurity, transportation challenges, all kinds of challenges. Our patients largely suffer from chronic diseases. Oops, go back. Chronic diseases and usually multiple chronic diseases. So the average age of our patients is in the 50s. And the most common diagnoses that we take care of are diabetes, hypertension, cholesterol issues, asthma, depression. So we truly see patients for years and decades. I can tell you personally, there's a patient that we still see regularly that I saw as a first-year medical student in 1999. She's still our patient. She's in her 80s. So we truly are not an acute care clinic, not a wound care clinic, not a fly-by clinic. We are a clinic that sees people over time in continuity for people who do not have any other access to care. Okay, next slide, please. And this has been our mission since the beginning. We first opened in 1997, and our clinic was founded by Dr. Ellen Beck, who's a fantastic role model for both of us and mentor. And she started the free clinic with a group of passionate students who just asked the question, why aren't we doing more? Where's the free clinic? Why are we not serving San Diego? So with that idea of service and mission-oriented care, we first opened in a church in Pacific Beach serving the homeless. And from those very humble beginnings of seeing 10 patients one night a week in the basement of a church, we have grown. Now we have 5 different locations throughout San Diego. And one of the most important things for me to tell you is that all of our clinics are located in community locations. We don't have a clinic space that looks like anything you might imagine a clinic looks like. We are in the basement of churches. We're in a classroom of a public school. We're in Veterans Village. We are in the community in community settings. And so that's both a blessing and sometimes poses some challenges as well. We've had to open and close a couple clinics. So the timeline here is not really for the details, but just for our story, just so you know that we've tried to grow, meet needs, evolve, change, and also take care of people where they're at, which is the next slide. Please. So this is just a snapshot of the red hearts with the little heartbeat are the locations of our clinics, and the blue pins is an example. It's a random selection from one week of where our patients live. So as you can see, our patients live actually as far as Vista North. They live in San Ysidro to the south. They live as far as Lakeside to the east. They live all over San Diego. And so, and again, as demographics have shifted, our locations have been more and sometimes less convenient for people. You can see our Pacific Beach site is not particularly in the community anymore, since originally we would take care of a lot of homeless. That's not where our patients live right now. But our other sites are pretty well situated to take care of patients where they live. I saw a chat float up, so I'll just address it, but more than 90% of our patients speak monolingual Spanish. And so we have the most amazing group of interpreters. I'm just so blessed to work with so many amazing people. We have 20 plus interpreters per clinic session working with us, which is an absolute blessing. Next slide, please. Okay, so what are we able to do? What are we able to do for the patients who don't have insurance? So each of our patients, for free at no cost to them, absolutely no cost, nothing's ever charged, they get medical visits. They get medical visits in primary care as well as specialty care. I'll get to that in a second. We're able to do labs for all of our patients pretty much without any limitation. And we're able to give medications for free to our patients. We prescribe dispense almost more than 20,000 prescriptions per year of medications for free to our patients. We're able to pay for imaging like ultrasounds, x-rays, things like that. And as Dr. Rodriguez said, we're able to make referrals to our partners that have a dental clinic, our partners in social work, our partners in the legal clinic. So we have transdisciplinary partners as well as specialty partners in cardiology, ophthalmology, nephrology, all kinds of partnerships that we have to help see our patients for free. We also have a food program, which Dr. Rodriguez is going to tell you more about, but which provides 8,400 pounds of free food per month for our patients. So it's we think it's as important as medication is to have access to food. And so that's a monthly program we have for all of our patients. And currently during COVID, which we'll tell you more about at the end, we're also doing home delivery of all of this to our patients so that they can shelter in place and stay safe during COVID. So every patient receives this for free in an ongoing way if they're seen every month or every 3 months, we're able to coordinate this as well. Next slide, please.
So as Dr. Johnson just mentioned, our patients receive primary care with myself and Dr. Johnson as the directors of our locations. We split our location responsibilities, and then we have many volunteers who come and help us because we have so many patients and students that we can't possibly see them all ourselves. And we have primary care volunteers, and then you can see here is a snapshot of some of the specialty clinics that we run within the free clinic. Many of these were started by students out of interest and also out of patient need. So they saw a patient who had a need, for instance, for a cardiologist, and thought, wow, we don't have that service here. And they would go out and find a cardiologist who wanted to volunteer with us, and a new specialty clinic would be born. And over time, just like Dr. Johnson and I are alumni of the medical school and involved at the free clinic, so are many of our specialty attendings now. They were our classmates, and now they are our peers who help us take care of our patients. Next slide, please. And again, when we talk about our transdisciplinary care, who are we talking about? We're talking about providing dental services with our dental partners. We have an acupuncture clinic, a legal clinic that supports our patients with any of their legal concerns. We have a social work team that helps us address, again, social determinants of health. We have our food prescription program, which is amazing. And I'll just say that we've always known that our patients were food insecure because we would hear about that in their stories. But several years ago, we actually partnered with Feeding San Diego and did a survey and asked our patients about food insecurity. And I think as much as we knew that that was an issue for our patients, I think we were all shocked at the level of food insecurity, the number of our patients who are severely food insecure, which means they either go hungry one day a week or at risk of running out of food in any particular day. And so again, with passionate students, started this food prescription program to help fill that unmet need for our patients. We also have a nutrition kitchen project, which is really fun. It's helping our patients in our community cook healthy meals with the food that is provided in through our food prescription program. We have a promotora model where we have health promoters who are trusted members of the community, and they serve and wear many hats at the clinic, but one of the most beautiful things they do is lead our empowerment group. It's a group for any of our patients who want to connect, build community, and support one another. And it's been especially powerful during COVID, when so many of our patients have struggled with isolation. Next slide, please. So I don't want to throw too many numbers at you, but we think these are important, and that is that every year we see 1,500 visits with our patients. We, as Dr. Johnson mentioned, provide 28,000 prescriptions, and the retail value of those prescriptions is more than $2 million. And we provide 2,500 households with food. So lots of great work being done. Next slide, please. So I just really, every time I see this picture, it makes me so happy. And this was from our fundraiser, which was last May. And there's many things I could say about this picture, but today, as I was reflecting on what I wanted to say about it, was who knew in May that we were still going to be living on Zoom all these many months later. But this is just a beautiful depiction of everyone who makes Free Clinic a family. And there's so many students, alumni, volunteer doctors, admin staff, everyone. And it's, I think, just a beautiful representation that it takes all of us coming together to get to do what we do with our students. Next slide, please. And then lastly, the background of this is names again of all of our volunteers who have worked with us presently and in the past. And together we're able to train over 300 medical students every year. And that's medical students from first year through fourth year. We have, again, Dr. Johnson and I can't do this by ourselves. We have over 100 volunteer physicians, specialists, dentists, pharmacy staff, and volunteers that help us take care of our patients and teach our students. And that amounts to over 60,000 hours of volunteerism and in-kind donations every year. Next slide, please.
And just to balance out the numbers, wanted you again to see faces. These are faces of our volunteers, many of whom are undergraduates, our volunteer medical students, our volunteer providers, and our very beautiful patients. And so just some examples of the workspaces that we share together with a shared mission of, most importantly, taking excellent care of patients who deserve high quality healthcare, as well as trying to educate and empower and inspire medical students to serve the underserved. That's what we're all about. Next slide, please. So with that as a transition, wanted to go to the last section of our talk before we open it up to answer all your great questions that I've already seen in the chat. I wanted to sort of identify concretely the ways that we believe that we're striving towards health equity through our work at the Free Clinic. Next slide, please. And we wanted to break it down into 4 discrete areas that we want to focus on today, both the ways that we're contributing to the workforce and caring for the underserved, providing access to care for a population of people that would otherwise be left out of the system. Wanted to talk about ways that we address social determinants of health to improve health equity. And lastly, wanted to talk about the impact of providing care to this population during COVID-19. So Dr. Rodriguez, next slide, please.
So yeah, we wanted to start off by talking about our workforce. And we have pre-professional students. We often call them pre-med, but understanding that not everyone is on that path. And these students are they serve many roles at the clinic. One of the most important that we have already touched on and absolutely could not do the work that we do without them is our interpreters, because the overwhelming majority of our patients are monolingual Spanish speakers, and very few of our medical students are native bilingual Spanish speakers. And so in order to provide our patients with language concordant care really provide them with the highest quality of care, we have interpreters for all of our medical students and attendings who are not native speakers. And what that means is that many of these volunteers who serve as our interpreters, many come from backgrounds that are underrepresented in medicine. Many of them come from disadvantaged backgrounds, maybe the first person in their family to go to college, and coming to the Free Clinic and working with us, volunteering with us, allows them for very meaningful clinical experiences. It exposes them to medical students who are just a few years ahead of them. And there's a lot of beautiful natural mentorship that happens at Free Clinic as the interpreters build relationships with the medical students that they're working with, and then provides them with an opportunity to get a letter of recommendation, which opens so many doors, whatever field they are going into after their time with us. And then obviously the professional students, our medical students and pharmacy students and pre-dental students, because in case you aren't aware, San Diego doesn't have a dental school. And so the students who run our dental clinic are pre-dental students. But these clinical experiences that students have at the free clinic, working with the underserved, we hope increases their interest in working with the underserved in the future. And Dr. Johnson and I fully acknowledge that not everyone wants to be us, nor would our patients get all of the care that they need if everyone went into primary care. And so our hope is that we're inspiring specialists as well. And we have a student who is now a resident, and she started with us as an undergrad volunteer, became a medical student at UCSD, and is now a resident in surgery at UCSD. And she's incredibly passionate about changing the field of surgery and the way that underserved patients are taken care of in that way. We also just found out a week ago that one of our other volunteers who volunteered with us many years ago and has had a non-linear path towards medical school, she was just accepted. And I think this is two beautiful examples of the way our volunteers are shaped by their time with us and eventually go on to become wonderful students and are committed in many different ways to taking care of the underserved. Next slide, please.
Great, thank you. At our very core, our mission is to take care of people who have no other access to care. So we believe that in doing so, we're addressing health equity, because otherwise these patients would not be getting their insulin, would not be having important cholesterol medication that might prevent heart disease, would not get needed cancer screening and tests. And so we believe that one of the contributors to health equity is by providing this comprehensive, hopefully very high quality healthcare that's humanistic and compassionate and empowering for our patients. And I'm going to talk about this in a slide or two, but wanted to also just mention that this population may have been easily left out during COVID when telemedicine took us all by storm. And so by continuing to be able to provide access to care despite the pandemic, and I'll talk more about that in a second, I believe that that's also a way we were able to keep a population of San Diego healthy during a very, very turbulent time. And I just wanted to mention, and acknowledge that we're not perfect. We know it's not the same as having HealthNet or Blue Shield and being able to go to a private practice. We're not so naive, but we do have some published outcomes on our diabetes outcomes that show similar outcomes in A1C compared to other clinical settings. We also publish outcomes that our blood pressure management is as good as anywhere, lipids, and screening and treatment for depression as well. We have ways we can grow. We have things that we're not able to do, but wanted to just acknowledge that we are providing quality care to people who have no other access to care. Next slide, please.
So just wanted to touch on social determinants of health. As you've already heard, a major focus of this for our patients is food and addressing the food insecurity of our patients by our food prescription program and our nutrition kitchen project. And this photo is just a snapshot of the food that our patients get at every visit. They get one large bag of fresh food and 2 bags of shelf-stable food. And I will say that I had never carried any of these bags before COVID, and many of our patients take the bus. They walk blocks from the bus stop to their home, and there's a lot of food in these bags. These bags are quite heavy, and I have I'm just so impressed that our patients were able to carry all of that home. But I think it really speaks to, again, the need that the food prescription program is filling. We already touched on our social work partner, but a little bit about what they do. Our patients struggle with transportation, and I think that's really been one of the beautiful positive things that has come out of COVID, is that because patients are able to stay home and have a telemedicine visit, are the times where patients were not able to make their visits because of transportation difficulties has basically been erased. And for so many weeks and months, we've actually had all patients show up for their appointments. We've had no shows because we've been able to erase that barrier for patients. Our patients struggle with housing and recovery and so many things. So our social workers are an invaluable resource in providing resources to our patients. And then partnering with the legal clinic, just some issues that certainly COVID has brought to the surface around eviction because of loss of job and difficulties with income and things like that, and then immigration as well. Next slide, please.
Okay, we're wrapping up here, but wanted to bring some themes back together in the context of talking about what we've been doing during COVID-19. So we are a clinic that's been around for 20 plus years and have never, ever done a telemedicine visit. And very suddenly on March 16th of 2020, needed to completely transform our clinic from an in-person, lovely, chaotic, loud, vibrant clinic to a quiet space where literally 100 people are operating from their homes, taking care of patients through telemedicine. And so it's been the most incredible year of growth and learning for us, I believe, for myself, I'll say personally, professionally, and also as a clinic. And so some of the things I wanted to share with you is that when evaluating how COVID has impacted our community that we serve, when we looked at the zip codes of the patients that we serve, we have found that over 70% of our patients lived in the zip codes most affected by COVID over the last 12 months. And a full quarter of our patients live in zip codes in South Central San Diego that have the highest rates, a quarter. So I'm talking about a zip code that has 10,000 per 100,000 cases of COVID compared to other parts of San Diego that have rates a third of that or half of that. So our patients have been living in fear, living in dangerous conditions. And luckily we were able to implement telemedicine and as Dr. Rodriguez said, had 100% show rates because in fact, while it was a challenge, it also addressed some barriers such as transportation. We were also able to evaluate as we were designing ways to help protect our patients. We were able to determine that 85% of our patients met the CDC criteria for being high risk for COVID, largely because of their age and the multiple comorbidities that I was talking about. And so through donations and combined efforts with our partners, able to provide surgical masks, face shields, hand sanitizer, all kinds of supplies for our patients to help keep them safe. And this has been a very disruptive time for them. Many have lost jobs or on the other side had to keep working potentially in conditions in a restaurant or in transportation or in housekeeping that maybe put them at risk as well. So it's been a distressing time. Many patients lost family members due to COVID. Luckily, we haven't had anyone in our clinic pass away from COVID, but we've had many patients have a family member or a loved one pass away in our community from COVID. And so the reported rates of emotional distress and the need for mental health referrals have absolutely skyrocketed this past year. And we're very grateful that we have bilingual, bicultural mental health providers who have just stepped up to the times and have been providing all kinds of mental health resources and support for our patient. So as I said, in March 16th, we went completely online. We currently do about 45% of our visits are video visits. We'd love for that number to be higher, but what we've learned about our patients is many don't own a smartphone. Many don't know how to use Zoom or have access to a family member who could help them. And so the rest we do by telephone, which is not ideal, but it keeps us connected. We have, Dr. Rodriguez and myself have both experienced, a patient's voice or face light up when they're able to see a person because they've been so isolated. They've been sheltering in place, they've been taking care of themselves, and they're missing that human connection. So having lovely, vibrant medical students and lovely interpreters and a sense of home and sense of community in the clinic has really helped, I think, a lot of people get through these tough times. And lastly, I just want to end with, I want to end this slide with mentioning that the students and the volunteers have just been incredibly inspiring. They always are. It's what keeps us going, is just working with these wonderful students. But what they designed right away, as soon as COVID hit San Diego pretty hard, is home delivery of everything. It used to be that the patient would come to clinic to pick up the meds and the food and the test strips and all of that. And instead, the students themselves have organized 35 deliveries a week. 35 delivery routes, I should say, per week. They go to multiple people's houses, drop off their medications, drop off blood pressure cuffs, oxygen meters, pulse oxes, so patients can monitor their oxygen levels. And they've done this all just because they care so much. And so it's just an incredible, it's been an incredible time. And I believe that coming back to the health equity aspect, I really do think that we're taking care of a population of people who are very high risk, living in areas that are very much impacted by COVID. And hopefully our efforts are keeping them safe, keeping them with ongoing healthcare so they don't miss their medications, miss their inhalers and their insulin and all that, and their food, and hopefully getting them through this difficult time as well. Next slide. I wanted to just mention that a student did a summer project because we wondered, how do our patients feel about this telemedicine thing? This is so new to us and it's so new to them. And so we're pretty proud, and I think this is a health equity issue, that 95% of people said that telemedicine made it possible for them to attend a visit that they would not have been able to attend if it wasn't offered in some format of phone or video. And I'm really proud that our patients felt that they still felt that sense of kindness and respect. They didn't feel like they were getting shortchanged on the time that we spent with them. And amazingly too, they still felt that their privacy was there as well. And so between the options of good, fair, and poor, 100% of patients rated their overall experience with telehealth as 100%. And this project was done over the summer of 2020. Next slide, please. Dr. Rodriguez.
So as we're wrapping up our time together, and I know I saw a couple questions about this in the chat already, which is, thank you so much for being here with us today, for your interest in learning more about the free clinic and how we are working to address health disparities in San Diego. And we would love to stay connected with you. We have students who are creating content for our Instagram feed, and you can follow us, UCSDFC. There are opportunities to volunteer. You can go to our website and learn more. There's also a Facebook group that you can, or one could join to learn more about volunteering opportunities as they come up. And there's information on donations, and people have been so incredibly generous with us during COVID. Students have connected us with companies who are donating PPE, and it's just been really beautiful to see people come together and offer what they have. And I think that's really part of again, part of our philosophy is we all come and you do whatever it takes to provide wonderful, compassionate care to our patients. And so we're all doing that together, and we're building partnerships as well. We have so many beautiful partners already, and learning how to grow that family. Feeding San Diego is a beautiful partner, and we're getting ready to embark on partnering with UCSD to help provide COVID vaccines for our patients. So we're always looking to build new partnerships to continue to provide that high quality care that our patients have come to appreciate, and also, that we believe that everyone has a right to. Next slide, please. So I see so many wonderful questions in the chat, and so we're excited to have some time to get to those. And really, again, just want to say thank you so much for being here with us and wanting to learn more about what we do. And we look forward to staying in touch with all of you and partnering together. So thank you for having us. We're going to go back to the beginning of the chat, and we'll just work our way down the questions. Jennifer had a question: how do community members know where to go for services and who is eligible? So word of mouth really is the way that our clinic grew. And our beautiful health promoter, Isabel, tells a really funny story when she started off as a patient, and when Dr. Beck, she then went on to become our first employee as a promotora, as a health promoter. And when Dr. Beck pulled her aside to ask her to become an employee, she actually thought she was going to get in trouble for having spread the word about the clinic and told too many people to come. So that's really how the clinic grew. And I will just acknowledge that, unfortunately, because of some challenges with funding in the past, we have not been able to take on new patients in quite some time. And so pre-COVID, our dream was to be able to shift things around in such a way that we would be able to reopen to new patients. And we just opened another day a week, and we're hoping that as we grow that, that will create some space for new patients to come on. In the past, 211 has listed us in their services, and patients have heard about us that way. Obviously, we don't think it's fair to be advertising on 211 right now, as we're not accepting new patients, but that's certainly another way that patients have heard about us. And as we mentioned, who's eligible: patients who have chronic conditions and those who do not qualify for health care elsewhere. Do you want to take the next one, Michelle?
Maybe what I'll do is I'll start from the bottom and work my way up. And if you want to answer questions from the top down, that way we can, look at different questions. So I'll start with the bottom with Karina. Oh, wow. New ones all of a sudden here. Karina, do we have any plans to have any fundraiser events to support the clinic? Thank you for asking. We have an annual fundraiser. It will be virtual again, unfortunately, but we'd love to invite you. And we just decided on the date last night at a meeting, and I believe the date will be June 8th. So we'll try and spread that very widely for you, but that's our annual fundraiser. There is a donation button in the on our website as well, but our annual fundraiser is in June. There's a question about whether or not we will continue to provide telehealth services even after the pandemic, and I would say absolutely. I think that I think we have been able to find a strategy that seems to provide convenience and safety for the patient, and also still convey that respectful, compassionate care. So if a patient mainly has a visit that's centered around reporting blood glucose, for example, or mental health, I think that there will absolutely still be a role for having that visit be telemedicine. I see the future as a blend. And right now the balance is to a lot of telemedicine, and we do some in person, and then we're going to bring that blend back up so that we'll be doing both probably forever. And maybe I'll take one more and then pass it back to you, Dr. Rodriguez. Thank you, Eric, for being a volunteer at the Free Dental Clinic. The dental clinic is absolutely incredible. And then wondering what the outlook is for future expansion of free clinics and what the challenges are for providing this care for even greater populations. So I'm not sure, Bryce, if you mean for our free clinic expanding, but I'll take that as perhaps what you meant. The outlook for future expansion. We used to have 6, for medical clinic, we used to have 6 clinic sessions a week, and we're currently at 5. So I feel that that's a very short-term goal in the next 2 years to get back to 6. That will help us see more patients, that will help us take on new patients. And I think that that is on everyone's priority, is to bring us back. The challenges of opening even more sites, or I would imagine it might be on our minds to try and switch our PV clinic to a site that might be more central for our patients and location. There's many challenges because it's very difficult to find a community partner that's willing to let you bring literally hundreds of people to your location and set up dental chairs and air conditioning and exam tables. And we even have a portable ultrasound machine at one of our clinics. And so it has to do with finding the right partner that's able to accommodate a large group of people, patients, store medication safely for a pharmacy. There's a lot of challenges, but we'd love to explore, absolutely explore expansion over the next couple of years, with our first immediate goal being getting back to 6 clinic sessions a week. So I hope I answered your question, Bryce. Dr. Rodriguez?
So Fifi asked about how long it takes for a patient to be seen. New patient, old patient, doesn't really matter. Our students spend somewhere between 30 minutes to more with our patients. We really encourage students to take the time to really listen to the patient's story. We think that's really important. You have your whole career to see patients in 10 or 15 minutes. We don't ever ask that of our students. And so the students see the patient first, and there's a teaching element too. A first-year medical student is being coached by a fourth-year medical student, and then together they talk to the attending physician about the patient, and then everyone goes back together and sees the patient. So a visit can be quite long. Housing program referrals, that can sometimes be challenging for our patients, but we do, our social workers, you know, if someone is in an unsafe or unstable housing situation, we do try to work with them to resolve that. And as Dr. Johnson mentioned, post the Affordable Care Act, the number of our patients who are living outside has gone down, but many of our patients do have kind of unstable housing, doubled up, living on someone's couch or whatnot. Does our work coincide with the new School of Public Health? I can certainly envision us partnering with them and imagine, you know, working on some projects together, but nothing concrete as of yet. What are some ways we can help as Tritons? Again, please stay in touch with us. Check out our volunteer opportunities. We really appreciate and could not do the work that we do without everyone's contribution. Do you want to take a few?
Sure. I think my next question is from Krusha about how would undergraduates be able to join the clinic? We're very encouraging. I would encourage you to join us. We have currently 75 undergraduates that volunteer with us. And so we love working with you. There, as Dr. Rodriguez says, if you go to our website or click on the link that Lisa reposted in the chat, it has the how to volunteer. And then there's a subsection that you click on that will lead you to the Facebook group. That is where all volunteer opportunities for pre-health professional students is located. So I hope I answered your question. I saw a question from Angelica about, can clients self-refer and are undocumented persons eligible for services? Clients absolutely can self-refer. People can show up and we will do anything we can to try and help absolutely anyone. And we never ask anyone their legal status. We do not, that is not a requirement for our clinic, is to have legal status. We believe everyone has a right to healthcare and are happy to provide it for anyone in need. Camalia asked about, if you don't live in San Diego, what are ways you can support and be involved in the clinic? We'd love to have you involved. I hope we covered a couple ways. The rules of telemedicine include that if a provider wants to actually provide care, that they have to be in the state of California. But if you're not in San Diego, but in the state, and we're thinking that you are interested in volunteering, please reach out. But that would be the only other way to provide clinical services with us. And then, yeah, we work on a lot of special projects where Dr. Rodriguez and I are working with a lot of partners to try and find streamlined ways for our patients to get the COVID vaccine. And again, in a population of people with low tech literacy, low tech access, transportation barriers, how can we get the COVID vaccine or education about the COVID vaccine? So as Dr. Rodriguez said about partnerships, always looking for ways to improve the health of our patients, just thinking outside the box and working together as a team. So I hope that provided some ideas. Dr. Rodriguez, I think
we met in the middle.
Right. Yeah. Oh, you're in Tennessee. Oh no.
Oh.
Too far.
Happy to open it up to questions if anyone wants to unmute themselves and ask.
I don't want to take up too much time since I've already asked questions, but first of all, I just want to say thank you so much. This is incredible. I work with some students at Vanderbilt University in Nashville, and they have a free clinic here, and I hear a lot of similarities, and at the same time, some great takeaways for things that they could do with their free clinic here. And it's impressive that you have 5. I'm just blown away, and that you're doing home delivery of food and medications. It's excellent. Thank you so much.
Thank you. Thank you. I don't know if your Student-Run Free Clinic is part of, there's a national organization for the Society of Student-Run Free Clinics, but that's also a cool organization to get involved with and share and learn what are other student-run free clinics at different medical schools doing.
And we always say we didn't start off this way.
We started off with what?
4 students, patients, 1 room with a curtain down the middle in the basement of a church in PV. So it's been 23 years in the making, and really so much credit to Dr. Beck, who has just poured her life and career into making the free clinic what it is today. And obviously neither one of us would be here had it not been for the clinic and for her leadership and her mentorship. So
that's true.
But yeah, you know, many students, we meet with students from around the country who are like, well, we want to start a free clinic, or tell us how you do this. And sometimes it feels daunting. I'm like, no, we didn't start off this way. So starting small and going, Dr. Beck had a saying, she always talked about going deeper before we went wider. And I think there was so much wisdom in that.
Thank you. Thank you.
Thank you.
Thank you, everyone. And I wanted to say thank you to Lisa and Eliza and all the colleagues from the Triton Conference, from the Triton Alumni Conference. Thank you for inviting us and welcoming us and providing this format for us to talk to colleagues and share what we do. Thank you for listening. And I want to turn it over to Eliza, who I think has some housekeeping to wrap us up. Our contact information was on the last slide, which I believe you have access to. So feel free to reach out if you have any questions or follow up that would be helpful. Thank you all.
Have a wonderful rest of your Friday.
Great. Thank you so much for joining us, everyone. And a huge thank you to Drs. Johnson and Rodriguez for being here today. We really appreciate your time. And that was just absolutely fascinating and incredible work. I know we're all proud Tritons for sure after this session. Just so you all know, as attendees, a recording of this session will be available on the Triton Leaders Conference Hub later today. And there's still tons of great programming coming up. We have 3 sessions to start at 4:30, and then a networking session that will happen after that we hope you can join us for. That's all I have for today, and I hope you all enjoy the rest of your day and enjoy the rest of today's conference as well as day 2 tomorrow. Great, take care and go Tritons.
Thank you, Lisa. Thank you, Eliza.
That went great. Thank you. That was, gosh, that was a lot of questions.
Was it?
It was.
Okay.
But I asked you, like, was there any questions you want to ask? So I thought I might need to ask some questions. People were going for it. So that's great. And the numbers were good. We were at 38, 39 for most of the session, which is great.